Kharrazi.
Thank you, Matt. Good morning, everybody. These are going to be tough ones to follow. I've been very impressed with all of the presentations so far. But I'm here to talk to you about the California Biobank program, which involved a complete transformation. Imagine yourself a few years ago, and for some of us even more time, you're a laboratory assistant, sporting a heavy winter coat, working at the Department of Public Health. You're confronted with an Indiana Jones-like warehouse full of containers of ice cream, turkeys, pizzas on one side, and thousands of boxes of specimens on the other. And it's your charge to find the box, one box, that contains the one dried blood spot out of about 2,000 that you need to pull for an important study. You find the pallet you're looking for and start cutting the plastic wrap off the 30 boxes on this pallet. Fast forward to today. You walk into a modern facility with 2 freezers, seemingly football field in length. There are 3 levels high with rotating carousels, 3 of them inside, much like you have at a dry cleaner. Standing in your lab coat on a pneumatic lift outside the freezer this time, you indicate on a computer screen which specimen you want, and automatically it is brought to the front of the freezer. You open one of the 9 small doors, reach in, pull out the tote, and the specimen you need is in one of the barcoded bags that help you find it swiftly. This vignette provides but one example of how the California Department of Public Health went about meeting its mandate to provide archived blood specimens from screened newborns and pregnant women to researchers studying the causes of human diseases and evaluating new ways to screen for these diseases and to treat these diseases. The California Biobank program is a uniquely diverse, population-based biospecimen bank among the largest in the world, housing over 17 million, that's with an M, specimens. By making these millions of specimens, we wish, and associated data available in an anonymous and confidential manner to approved researchers only, the program assists in optimizing the health and well-being of Californians. The project drew upon the experience of over a dozen partners in public, nonprofit, and private sectors, and required funding both in and out of state government. It started with vision from our predecessors over 30 years ago to bank screening specimens. It continued with the conduct of studies exposing the vast research possibilities, and then included explicit legislative mandates. A large grant from the National Institutes of Health, NIH, known by many of us, helped us develop the infrastructure to link together specimens and data sets from across the department. Developers and scientists working together consolidated the multiple specimen location systems of the past into a single web-based system, which tracks the specimen locations, the research studies that these specimens were a part of, and provides other information about the specimens in real time. The system is configurable so that as new facilities and storage structures are added at any time, this affords our program the ability and ease to achieve added and best value. The program went from no formal mechanism of recording and tracking requests for specimens and data to an online self-service system for requesters to provide documentation, place an order, and track fulfillment of their requests. Researchers and other stakeholders like the California Biobank Community Values Panel provided invaluable input on a broad range of issues like protection of privacy and confidentiality, consumer education, and public awareness. To achieve long-term economic sustainability, we established and promulgated into state regulations fees for specimens, and data services to support the program staff and system infrastructure. The California Biobank program is about saving babies and improving public health. With this transformation, we have catapulted into the 22nd century, able to speed up the pace of research. I'll close with saying that within the last 3 months of the program, we've processed what previously took 3 years to complete. If there's time, I'll tell you about some of the exciting studies. Thank you.
Thank you. Wow, that's incredible to just envision and visualize the laboratory and the biobank. I have a question. There are many biobanks, obviously, around the country. Did you model this after another one? Did you take lessons learned? Or was this really something sort of organically you all came up with in terms of your whole new processes?
Both. We, in some ways, are what everyone else compares to, but we weren't so cocky to think that we had nothing to learn from other state biobanks, for example, that retained newborn specimens.
Because libraries also sort of now, if you go into stacks, you can't wander in a stack, it's on a machine. And I was envisioning sort of that as well as NCIS as you talked. What length of time did you take to before you brought in the technology, if you will, what length of time did you take to really devise the process that you wanted to bring the technology to? Is it years?
This is years. This is, in fact, over a decade to bring this to fruition and culmination. So I think we grew from visions of our predecessors, added more, and with our experience both with academic researchers as well as government researchers, and that includes the CDC, the Centers for Disease Control, the federal side, and funding opportunities, we were able to make this happen. We learned from our experiences. We realized, I think success begot success in this case. We realized that so much was possible that we needed to do this. It was critical.
I may have a follow-up after about that ice cream, but I'll turn to...
Well, the importance of this is readily apparent to me. You can't pick up a newspaper without discussions of public health and concerns, whether it's measles in California or Ebola from Africa, and especially dealing with newborns as you are. Obviously, it's critically important, but that doesn't mean it's easy to fund. In government, funding can be a huge challenge. I'm sure for everyone here, they've got ideas that they would love to see funded. Can you tell me a little bit about that process in terms of what you had to do to get it started? And then the second half of that is, do you think you have a sustainable funding system to keep this going for years to come?
Your question is something I think we all in this room have to deal with. Good ideas don't just get funded. Sometimes I think the approach that has worked the best is for other people to validate how important it is by funding you from the outside first. And once that's recognized that someone else thinks it's a good idea, then it's easier to convince those who are your supervisors and managers above. So in some respects, that was the strategy here. Many studies supported this work. These prior you could think of them as pilot studies, and then ultimately a very large NIH grant pushed us over the precipice. And it was too difficult to ignore how important this was. Legislation came in sort of verifying that as well with other initiatives to fund the bank. And so piecemeal we came together. And now, as far as our ability to go into the future with steady funding, it's fee for service basically. So every dollar that is paid for specimens and for data goes back to maintain the system, to continue to do data linkage, to bank specimens, and to provide them to researchers as needed.
I can, just a quick follow-up on that. You said you had multiple funding sources, and if I understood you correctly, you said that they funded your project, but I'm kind of wondering how many of their good ideas had to be incorporated into your plan for you to successfully get the money?
The question is, how many times do you write a grant before it's funded?
Fair enough.
Persistence. Known for that, as are many of my colleagues. So good ideas you need to stay persistent about to make sure if you don't succeed this way, try that way or this way. However, to get there.
Yeah, good lesson for us all.
Yeah. Great question.
I think that's
Done,
time.
yeah, it's on time's up. Wow.
All right. Thank you very much.
Thank you.
Please visit our table 15 in the exhibit hall.